And with that, I would like to present Dr. Brian Nichols.
Well, thank you for the great introduction there, Alan. Nice to see everybody here this morning. Thanks again to our sponsors. You know, they're the ones that make this all possible. Both the sponsors, they are for people that are new medical cannabis patients. Those of you who have signed up for the voucher, your sponsors are picking up that part of your check. So we really do appreciate that. All the exhibitors down here, they do pay fees for all this, and it really allows us to have this particular expo today. I'm going to talk a little bit today about the basics of medical cannabis. I am an anesthesiologist. I've been practicing chronic pain management about 20 years now. I first kind of became interested in using cannabis as a medication as I started performing drug screens on my patients as that industry started. I noticed that my patients that were popping up positive for THC on these drug screens, they weren't the patients that needed multiple medications, always needed escalations in their opioid dose to cover their pain symptoms. The patients that were popping up for THC on these drug screens, they were just doing better with less. And that's what got me interested in looking at cannabis as a medication. And over the last several decades, I've been advising patients on how to use it. Really kind of sketchy at first since we were working with black market stuff, but as the market has matured and we've known what's actually in cannabis, I've been really able to dial patients in to get good results. So just a little introduction to cannabis. I'm sorry these slides are so small here for you. Humans have a long history of cannabis. The first documented cultivation was in 4000 BC in Southeast Asia. First medical use it was documented right around 2700 BC. It was appeared in a Middle Eastern medical book in 1000 AD that documented a lot of the medical benefits from it. Spread throughout India at right around 1000 BC where it was used for certain religious sacraments and was used socially and medical benefits were noticed. That was about 1840s is when it came to Western medicine. William O'Shaughnessy, Irish physician, brought seeds from the cannabis indica plant to Ireland, grew some plants up, made tinctures from it, gave these tinctures to his dogs, didn't kill his dogs, so he started using it in patients and started observing a lot of medical benefits. It spread throughout Western medicine in the United States also up into from the mid to late 1800s until about 1937 when the Marijuana Tax Act was implemented that essentially made cannabis illegal in the United States. It was later on, I can't read my dates here, but I'll just tell you, it was a little bit later on, is when the chemical structure of CBD and THC were elucidated in 1963 and 64. A little bit later on, the endocannabinoid system was identified, followed by the development of the theory of the Entourage Effect. And today, last time I looked, it was more than 33 states had cannabis in some type of legal form, and I'm sure there's more than that now in the United States. So one thing that we've noticed with our history of using cannabis is how easily cannabis helps so many different conditions. Up to 90% of patients receive some improvement in their symptoms using cannabis. Great, wonderful virtue about it that we've noted for millennia throughout human experience. Now, one of the questions you may ask is, well, how does cannabis help all these different symptoms and helps us so very easily? Well, you have to have a basic understanding of the endocannabinoid system to get a handle on this. The endocannabinoid system, it is composed of three different parts. It's composed of endocannabinoids, it's composed of endocannabinoid receptors, and an enzyme system. The primary endocannabinoids in the human body, don't really have to know these, but they're called AEA and 2AG. These endocannabinoids are used as neurotransmitters, and they are very similar in chemical structure to the phytocannabinoids. Those are cannabinoids the cannabis plant makes, like THC that most of you may be familiar with. Now, how it works is one nerve makes the endocannabinoid. It comes across the space between the two nerve cells. On the surface of the other nerve cell is what's called a receptor. It's a large three-dimensional chemical group. When the receptor and the endocannabinoid come in contact, and if they fit just right, puzzle piece is the analogy a lot of people use, and it's a good one. It does what the scientist terms to have bound to this receptor. It activates that receptor, causes the nerve it's attached to just to do something different and changes its behavior. Very generally, that's how the nerves in your body communicate. I'm just going to mention it here. The other component of the endocannabinoid system are enzymes. Enzymes are necessary to break down these endocannabinoids so they don't continue to activate the system. Now, these endocannabinoid receptors I'm speaking of, okay, they're present throughout your entire body. There are differences in which of the subtypes are located where, receptor density. There's lots of finer points to it, of course. But I think the take-home message for most patients is they're present throughout your entire body with one exception. There are almost none of these endocannabinoid receptors on the human brainstem. This is, if you can see it from back there, this is a histological specimen, just a slice of human brain tissue. And they've used a special chemical technique to stain the endocannabinoid receptors. They appear dark, and you see over here there's these little, well, you can't see it there, but the dark outlines around the cerebrum. This is the thickened part of your brain, essentially. The area that says human down there, that is the brainstem. You notice how there's hardly any black spots on there. That's showing that there are hardly any endocannabinoid receptors present on the brainstem. Now, this is important for you guys to understand because the brainstem, essentially, it keeps your engine running, keeps your heart beating, it keeps your blood pressure where it's supposed to be, it keeps your lungs moving air in and out. Now, the brainstem is part of the body a lot of medications will poison and kill patients. All of us are familiar with the opioid epidemic by now. Your body makes substances very similar in chemical structure to the opioid medications. We call them endorphins, and they are used as neurotransmitters. Older people in the audience maybe remember Jim Fisk and the runner's high. Endorphins were associated with that. Endorphins are neurotransmitters. Now, there are endorphin receptors on the brainstem. When a person takes opioids, whether they're prescribed medications or street drugs, some of these opioids are going to bind to the endorphin receptors on the brainstem. And it's a bit like a volume control, kind of slows down their respirations a little bit. Yeah, they take too many of the opioids, turns off the respirations, and that's why people die. What I want you to understand that is without endocannabinoid receptors on your brainstem, you can't be poisoned by cannabis. You cannot overdose on it. That really illustrates how safe cannabis is compared to a lot of the other medications that many of you may have been prescribed over the years to treat your chronic pain conditions. I always tell patients, I don't know how you guys look at things, but the way I look at things, God sure was kind to us. We've got endocannabinoid receptors everywhere throughout the entire body except for the one place that's going to kill you. I kind of side with my Hindu friends on this one. I don't think it's a coincidence at all. They tell me that one of their gods, Vishnu, showed Shiva cannabis. Lord Shiva so loved man that he gave it to us. It's actually been a sacred herb of Hinduism and a sacrament in that religion, at least among the Shiva followers, more than 3 millennia now. All of this comes into play because it really illustrates something about cannabis. One of the things that your doctors do all day long, you might not notice us doing it, is we've got old legal scales in our head, right? We put risks of a certain operation, procedure, medication we're suggesting to a patient on one side of the scales, put the benefits on the other side, see how it weighs out. A lot of times it's really a close call, it truly is. Sometimes it's very clear which way to go. In the case of cannabis, when you consider the risks to an individual are negligible or extremely low, when you put even the possible benefit of trying it on the other side of the scales, it almost always tips it in the direction of considering cannabis as a viable alternative or addition to other medications. Now, the endocannabinoid system, it's what we refer to as being a homeostatic mechanism. It doesn't do one particular thing. What it does is it works with and coordinates all these other systems in your body to keep everything under optimal tune, but pretty much for survival of the organism. Your body spends every minute of the day just trying to make it to the next minute. It really does. The endocannabinoid system, it's involved in a great number of processes. It's involved in your body temperature regulation, glucose metabolism, lipid metabolism. It's involved in muscle tone, movement, inflammation, pain, hormones, sleep, appetite, nausea. You name it, just about everything going on inside the human body. At some level, the endocannabinoid system, it is involved with that. So when you think about it, when we take a phytocannabinoid, again, those are the ones that the cannabis plants make, like THC, most of you are familiar with. You put it in a human being. The THC is going to interact with our endocannabinoid system. You're obviously going to affect a whole lot of processes right out of the box. That's why most patients experience an improvement in symptoms using medical cannabis, or cannabis of any type, really. Now, it's a great, wonderful virtue about cannabis, how easy it'll help so many people and why so many people are using it. And here it comes. Everybody knows there's one in every conversation, but I kind of view cannabis as those old Greek heroes I used to read about in high school a long time ago. You guys might remember how their biggest virtue is always the most tragic flaw that does them in the end. I see cannabis as being no different, really. Great virtue about cannabis. Almost everybody sees an improvement in using it, no matter what their symptoms are. Here's the thing. It does not matter what you use. You get a gummy bear from a dispensary, you buy a joint off the street. I always joke with my patients, if you hear your neighbor's got a plant grow in the backyard, you steal it and roll it up and smoke it. You're going to probably get symptom improvement from it. Truly is a great virtue about cannabis. The tragedy is, right there is where most patients stop. Taking a gummy bear, that helps my symptoms. Smoking a little bit of weed helps me out. But by paying close attention to the different cannabinoids, terpenes, and other substances in cannabis, the routes of administration, even the timing of all that, you can turn that little bit of improvement in symptoms that everybody gets into a tremendous improvement of the quality of their life. The first thing, that's a chip shot. Anybody can do that. Making the jump to optimal results, though, that has a tendency to be significantly more complicated, but that's what I've been doing with my patients for a long time now. And the key to doing that is to understand how to use cannabis properly. That's the purpose of you being here today. In order to know exactly what to do with cannabis, we should consider the components of it. There's lots of different chemicals in cannabis, lots of different ways of looking at it. I'm kind of a simple guy, so I break it into 3 different components. The phytocannabinoids, these are things like THC, CBD, and all the rest. These are produced by the cannabis plant, and they interact directly or indirectly with our endocannabinoid system we were speaking of. I think next up there is probably terpenes. Now, terpenes are another set of chemicals present in the cannabis plant. Other plants make them, insects make them too. They have a wide range of their own properties as far as health benefits in human beings. They also can modify the effects that the phytocannabinoids will produce. And the last kind of trash can category I use, I call it good humors. There's a lot of other chemicals in cannabis, including flavonoids and other substances that probably do add to the medical benefits that we do see in cannabis. We just don't test for them regularly, and they're not well studied. I got a list of a bunch of different phytocannabinoids. I think there's up to 90 of them they found so far. Just a couple I wanted to mention here. I'm sure you can't see them from the back. But THCA, you guys probably noticed that when you look at your bottles you get from the dispensary. THCA is the acidic version of THC. It is the one that is native to the plants. THCA, it doesn't cause euphoric effects. It does have some medical benefits for certain conditions. It's not the primary one that's been studied. When you light the end of a cigarette or put the lighter to your pipe, the heat decarboxylates the THCA. It removes a CO2 molecule essentially and converts it to delta-9 THC. The version of THC you're probably familiar with. It does have euphoric effects. The next one over there, I think I have 11-hydroxy-THC. 11-hydroxy-THC is not actually made by the plant. This is a version of THC that you make in your body. Delta-9 THC is processed by the liver into 11-hydroxy-THC, primarily with oral administration. 11-hydroxy-THC is much more potent and longer lasting than Delta-9, and that accounts for the fact that a lot of people do experience longer lived and more intense effects from orally administered cannabis. Let's see, we've got THCV. That differs from Delta-9 THC in that there's a couple of 2 fewer carbon atoms on this little side chain. Big deal, right? Oh, actually, it is a big deal. THCV at low doses is nowhere near as euphoric as Delta-9 THC is. It also is an appetite suppressant, stabilizes blood glucose levels in patients, has a lot of potential medical uses. Delta-8 THC, a lot of people have heard about that. Delta-8 THC varies from Delta-9, a double carbon bond, move from one carbon to another, big deal again. Oh, actually, it is a big deal. That small chemical change makes Delta-8 THCs about 200 times more potent than Delta-9 at shutting down nausea and vomiting. It also is a lot less euphoric. It's only 20 to 40% as high as Delta-9 is. Makes it a very useful molecule. CBD, oh, that's probably the most useful cannabinoid in a lot of ways, and probably the one that most of you in the room aren't getting enough of right now. CBD, in addition to working indirectly in the endocannabinoid system, it works on some areas of the brain that make it very useful for patients with anxiety and depression symptoms. For PTSD patients, for instance, I know a lot of people are interested in using it for that. It also has its own antibiotic, antiviral, antioxidant, anti-cancer properties, as most of these cannabinoids do. CBG, just going to mention that one there. It's a very, very potent anti-inflammatory cannabinoid. It was very rare for a while. They have developed certain strains of cannabis that produce only CBG. For my patients with extremely high inflammatory conditions, autoimmune disorders, very severe osteoarthritis, and inflammatory bowel disease, the combination of CBD and CBG has really been a lifesaver for a lot of them. And then there is cannabichromene, that is CBC. It's a relatively common cannabinoid, not very well studied, unfortunately, but it does look like it has anti-cancer, anti-anxiety, and some little niche areas in pain as far as specific kind of nerve pain that people experience. So we've got all these different phytocannabinoids, as they're called. Based on which ones are present, they all interact with cannabinoid receptors that are located in different areas throughout the body. Kind of based on the interaction of these phytocannabinoids with the receptors in the location, that's how they produce the effects. Now there's a whole other set of things I've mentioned a couple times here, and they are terribly important, but they are a very, very vast and complex category, so I'm going to keep it real short on terpenes here. Terpenes are really the special sauce in cannabis. You wonder why one cannabis strain makes you feel different than another. You look at the cannabinoids present, well, they both measure 22% THC, maybe just a little trace bit of CBD. Why do they make us feel so different? It's because of the terpene composition in these. Now, terpenes are aromatic compounds. Cannabis produces them. A lot of other plants make them. Insects make them too. They are used by the species that produce them for their own advantage. One of the terpenes, a very good anti-inflammatory cannabinoid, terpene, I should say, beta-caryophyllene. It's kind of a bitter tasting thing. You find a lot in black peppercorns. Plants have a tendency to produce this terpene on their lower leaves. It doesn't taste too good, so it kind of drives off herbivore predators. Bees make a terpene called geraniol. Geraniol they deposit on flowers that are good nectar sources for the hive to attract other bees. Now, flowers figured this out, and some flowers, like geraniums, make geraniol that attracts bees to the flowers. It improves pollination, further propagating their species. Now, these terpenes, they have a vast variety of effects. They have variable anti-inflammatory, antifungal, antibiotic, antiviral properties. They do interact with the phytocannabinoids to accentuate certain effects. They also do have their own individual effects. Most of them, I believe, are central nervous system depressants, meaning they kind of give you a chill, kind of a relaxing vibe to them. They are extremely potent substances with concentrations, if you ever look in the laboratory report on your flower, concentrations above 0.05% are considered of pharmacological interest, meaning we do expect you to receive some of the medical benefits from these terpenes, even at extremely low concentrations. And for anybody who's interested in it, we'll be demoing terpenes only. If you ever want to know what terpenes make you feel like, HypnoSenscape, they're right across the aisle from Buffalo Company. We've got a machine that will dispense terpenes out to you so you can actually see the effects of terpenes alone. And I encourage you to give that a shot, or it's really an eye-opening experience. All right, so when it comes to cannabis, how do we classify it? The original way of kind of separating cannabis out was a botanical classification. Most everybody's heard of sativas and indicas, right? Well, sativas, this particular species of cannabis, they tended to be really long, tall, lean plants. They had narrow leaves. They tended to be very bright green. it was noticed that when you consume the sativa strains, they kind of gave you some alertness, helped with depression, helped with a bit of focus, gave a bit of energy. The other type of cannabis that was present at that time, the indicas. Now, the indicas tend to be short, stocky plants. They had broader leaves, much darker green. And it was observed that consuming that particular plant, it was much more sedating, helped more with pain, improved appetite in patients. So, yeah, everybody was happy. We got indicas and sativas. Which way you want to go on things? Yeah, human beings, we don't leave well enough alone, do we? The cultivators over the years have decided to, well, we can crossbreed these plants to try to pull out the characteristics that we're really looking for so we can make strains with different effects. So as anybody that's been to a dispensary knows, oh, God, they got a lot of crazy names out there. They got Bubba Kush, OG Kush, Confucius Kush, you guys have seen them all, Super Lemon Haze. With that many strains out there, it makes really understanding which one's going to do what very, very complicated. There's too many choices available. You combine that with the fact that you combine an OG Kush crossed with this, you mix a little sativa in it, and you try to determine what effects you're going to have by what the parents of the plants were. Almost impossible to do, and with the myriad choices out there, it's very confusing to patients. You combine that with the fact that you can have even the exact same genetics of a plant, the exact same seeds. I use for an example here, skunk shocker. The seeds of skunk shocker grown in Ottawa, Canada, may differ slightly to significantly different in the cannabinoids and terpenes they produce compared to the exact same seeds grown in Cook County, Illinois, compared to that grown in Whitehall, Arkansas. And that's really because cannabis, it's pretty much like human beings. The genetics give you a potential to be something, but the environment plays a key too. I always like to use Tiger Woods as an example. I don't know why, but genetically, he's set up to be the world's best golfer. You know, maybe he feels the breeze on his cheek and he knows to cock his wrist in a half a degree to make up for that slice. Maybe his knees fall through a little bit more than anybody else's. Genetically set up for that. And his dad put a golf club in his hands when he was 3 years old, and hey, you got a world championship golfer today as a result of that. Had Tiger Woods' father, though, been into hot rods, was a hot rod mechanic, probably today Tiger Woods would be a real mediocre hot rod mechanic today and not play golf at all. The environment plays a key. So, since we can't really go by strain names anymore, kind of a more broader categorization has come out, and you guys have seen this at the dispensaries. You'll see everything listed as a sativa dominant hybrid, indica dominant hybrid, or straight hybrid, whatever that means. Well, we fully expect sativa dominant hybrids to give you sativa-like effects, indica dominant hybrids to give you indica-like effects, right? Well, you can't really go by that anymore. As you've probably noticed if you've been out in the dispensaries and tried some cannabis, there are some of the indica dominant hybrids that will make you quite paranoid. There are the sativa dominant hybrids that will well give you that dreaded couch lock. So it's not a very useful classification either. This has led to Dr. Ethan Russo. He's one of the big research guys in medical cannabis. He's come up with a different way of looking at cannabis, and I do subscribe to his particular theory here. Dr. Russo notes that, you know, really, you can't use the anatomical classification of indica and sativa anymore to really tell what chemicals are in the plant. There are too many variables. You combine that with the intensive hybridization and crossbreeding that people have done over the years, strain names don't mean anything either. He came up with the concept of the chemovar, that is the actual chemical composition of the cannabis that you're looking at in front of you at the dispensary. That's what you really have to know to determine the effects that that cannabis is going to produce for you. What we're kind of landing on and what this whole talk today has been about, and Alan mentioned it too, is the entourage effect. The entourage effect was a theory that Dr. Raphael Mechoulam came up with. Dr. Mechoulam, he's the biochemist research guy in 1963. He described the chemical structure of CBD. 1964 was THC. Dr. Mechoulam says that really it is which of these cannabinoids, of the myriad ones that are available, which of the terpenes that are present in any particular specimen of cannabis that we're looking at in front of us, the chemovar. That's what determines the effects it's going to have in a human being. You have to have the simultaneous activity of all these different cannabinoids and terpenes together within the human body to fully appreciate these benefits. And that really the cannabinoids and terpenes, when they're together, when they're working together, the effects are greater than the sum of the individual components. We call it potentiation in medicine. You know, if THC takes away 20% of your pain, CBD takes away 20% of your pain, when you use them together, you don't get 40% of your pain gone. You may get 60% of your pain gone. So it is the interaction of all these chemicals within cannabis. That's what determines the effects it is, and that's what you have to really take into account to maximize the effectiveness of it as a medication. So again, it's which of the cannabinoids and which of the terpenes are present in that little specimen that we're looking at. That's what determines the kind of effects it's going to have in a human being. Now that makes it necessary for you to perhaps look at the laboratory analysis to figure out what the chemovar is. I know it's far too small for you to see from the back of the room, but that's a Steep laboratory report from a bold strain from a couple years ago, a really nice balanced strain called Z7. If you could see this, you'd see it's about half CBD, half THC as far as the cannabinoid profile goes. It does show some of the minor cannabinoids. There's some CBC and there's some CBG. I think there's a little bit of THCV present in this. It's relatively potent, I believe, at right around, I'd have to look at it, it was like 18% total cannabinoids, I believe. When you look at the terpene profile that's attached to this, you'd see it's about average. It's a little bit less than 1% total terpenes. It is heavily myrcene dominant. Now, myrcene is a terpene that has its own pain-relieving qualities to it. It also is a good muscle relaxer and is a little bit sedating for patients. This would be a great strain for patients with arthritis, for patients with fibromyalgia, peripheral neuropathy patients. It would also be a good patient for novice, or a good strain for novice patients to kind of get used to the side effects of cannabis, which is being high. When you administer CBD and THC concomitantly like this at the same time, it really tends to moderate it. Really a great medical strain. I hope to see more of these in the future here soon. So talk about the entourage effect. Again, the whole point of this lecture. Little clinical pearls, as we say in the clinical, or in the medical business here, points you really need to take home from it. I better get a little closer so I don't miss anything, guys. Go through all this. As we said before, it's the presence and the relative ratio of these cannabinoids and terpenes. That's what determines the clinical effect. And you're going to really have to know that to get yourself dialed in best. Matching the individual and their condition to the most appropriate mix of cannabinoids and terpenes, that's how you get the best response you can from cannabis. And look at one of my patients right here who's been doing this, and she can say that it's really made a difference in her life. Always remember, and if you remember nothing else from today, remember that the combination of THC and CBD is almost always more effective than either one alone. The thing I see most commonly in patients is they are using medical cannabis, not much CBD in it. You're only getting a little bit of the improvement that you can receive. And for people, if there's anybody here that's like this, I encourage you to come to the Taste of the Entourage Effect Buffalo Company is sponsoring. We're going to be giving out samples of CBD and CBG. We'll talk about the Entourage Effect, let you try it on, so to speak, to see how it works. You have to remember that the combination of the cannabinoids and terpenes, again, is more effective than either one alone. Combination's important. That really, like I mentioned, you're going to have a laboratory analysis of these cultivars to really determine the best choice for you. And with all the different things in cannabis, you want to pick up those good humors we don't know about, whole plant extracts of the plant are preferred. All right, I know it's a lot of information, kind of a crash course there. I hope you did find it somewhat informative on things, or at least gave you something else to think about. More than happy to take any questions from people that have them. Well, there's always Alan. He's always got one. Alan, yes, sir. Well, I haven't heard about the high THC making you blind. Certainly THC does decrease intraocular pressure. In the state of Arkansas and a lot of the states, glaucoma is a qualifying condition for cannabis. I always tell patients that are getting a certification for me under that diagnosis, don't stop taking your prescribed medications. Almost always cannabis should be used in addition to prescribed medications, but glaucoma in particular. Alan, you're right, THC does decrease the intraocular pressure, but it's pretty short-lived in the effects. Patients that discontinue the normally prescribed medications have a very good track record, do run a risk of going blind with it. If they, yeah, never discontinue prescribed medications. And my opinion, I don't really think the state should be in the business of telling doctors which diagnoses are appropriate. But since they are, I think glaucoma should be crossed off the list, really. Because I don't think so, because I think a lot of patients that aren't well informed, they will think, oh, you know, I'm using cannabis now, I don't need my glaucoma medications. Those are patients that are at a real high risk of losing their vision. Anybody? Yes, ma'am? Yes, I am. And dementia, Alzheimer's, and all of these, they are central nervous system inflammatory conditions. The cannabinoids, particularly CBD and CBG, and there's certain terpenes also, are very potent central nervous system anti-inflammatory agents. Again, these are not controlled studies, anything that the FDA would look at. But on my patients that I've been treating with central nervous system inflammation, I can't say that my MS patients, Alzheimer's patients, other dementia patients have gotten better, but over the years they have not progressed, which is a big thing for most of them. You combine that with the fact that some of my patients they're caring for their family members now that they're getting older. One of the tragic things if you're taking care of a parent with dementia is as they start to lose their memory, they become combative towards, you know, their sons and daughters and such. Makes it very difficult for the caregivers. CBD can relieve a lot of the anxiety that these patients feel as they start to lose their memory. It's very disconcerting to them, and they tend to lash out at people. CBD, in addition to hopefully slowing down progression of the disease, it does help with some of the behavioral issues that they have. So yes, ma'am, I always try to incorporate that into patients with those diagnoses. Parkinson's, I've got, let's see, 3 patients with Parkinson's I've been working with, one of them for up to about 7 years now. One of my patients, he's a younger gentleman, got diagnosed right after he and his wife got pregnant after spending a fortune on in vitro fertilization. He rapidly kind of deteriorated. This was before it was legal in Arkansas, of course. He was on high doses of methyl dopa, having side effects to it with the shuffling and pill rolling. He was very, very interested in trying alternatives. I gave him advice on how to use cannabis. His methyl dopa stuff, he's down to about 25% of his original dose. You can't tell his Parkinson's looking at him. He's doing very well. He's not progressed yet. We, of course, think it has to do with cannabinoids. Again, you know, no studies on this at all. I just relate my clinical experience with patients. Again, I never see any reason not to try it on a lot of these patients because how safe it is. All of my Parkinson's patients, again, just a couple handfuls of them, again, have not seen progression on their symptoms. Another thing with Parkinson's patients, and I think you probably know one, the side effect of the medications that a lot of them will get, the tardive dyskinesia, you know, the pill rolling and the jerky movements. CBD moderates these effects a lot, and they do with a lot less of the side effects of some of the new drugs you may see advertised on television for these particular things. So I think the endocannabinoid system is intimately involved in all of the neuroinflammatory and neurological disease processes. Yes, ma'am. Yes, I can't see who you are, but yes, ma'am, I think so. I'm sorry, is the what now? Oh, well. She was asking, is the information available enough to get a good terp profile in the strains in Arkansas? Okay, well, here's one of the issues with that. In the state of Arkansas, regulation requires the cultivators to perform extensive pesticide, heavy metal testing, and so forth on these crops. That's very expensive for them to do in every 10-pound batch, I think it is. As far as potency testing goes, they're just looking at CBD and THC potencies. They don't look at the minor cannabinoids or terpenes, the things that are terribly important. Some of the cultivators do it. It's done at added expense to them. You know, their businesses are trying to minimize their expenses. I have been talking with some of the cultivators. One of them in particular is producing full cannabinoid and terpene profiles in all their strains regularly. I'm starting to have access to that. Next step is how do we make sure the patients have access to it? The way I look at it, all of you guys can make this happen. You go into your dispensaries, you start asking for terpene profiles. I want to know what that OG Kush has in it. Pull the lab on it for me. The more and more people that start asking for this at a consumer level, the more likely it is that all the cultivators are going to produce it. If you guys go in and start asking for terpene profiles and only one of the cultivators is providing them, well, their sales are going to go up. I'm pretty sure their competition is going to jump right on board here. And all of you guys can start really figuring out the proper chemovar you need to leverage the entourage effect. So we're heading in that direction right now. I would say no, it's not adequate. Not adequate now. Yes, sir. Well, sir, I would say that I would like to see it be that whatever a physician feels may benefit a patient is how it should be. I think when you get locked into qualifying conditions, you get into the problem, like glaucoma. I just don't think it's a good drug for glaucoma. On the other hand, there's other conditions that I tell patients when I'm certifying you for a medical cannabis card. Okay, you got a qualifying condition. What else you got going on? It doesn't mean that we can't treat additional things with it. So I really think that it should be up to us to decide what patients are appropriate for cannabis and which ones aren't. Yes, sir. I have little knowledge as far as muscular dystrophy. My guess would be, being a progressive degenerative muscle disease, it probably might help somewhat with symptoms. I doubt it's going to help with the progression of it, but way outside of my wheelhouse, Alan, to really comment accurately on. Anybody else a question? Now's your chance. Yes, sir. Well, as far as extraction from cannabis flower, really, they all can be safe. It just has to do with technique. If you're asking kind of a little bit about Simpson Oil, is that what you're kind of leaning towards here? Is what I think you're asking? Okay. With Simpson Oil, I've seen a lot of different recipes on the internet. Some of them are very scary. I'll see naphtha being used for some of them, isopropyl alcohol, benzene even. These are solvents that certainly they're efficient at pulling the cannabinoids and terpenes out of the plant material, but they're extremely toxic products. Now, if you're a skilled chemist and familiar with full solvent extraction, you do testing, you can't produce it using these things. For the do-it-yourself patient, a very cost-effective way to produce RSO for yourself, I recommend only using ethanol, pure grain alcohol, as your solvent for this. Even if you don't get a full solvent extraction, you probably are not going to, it's ethanol. It's relatively low toxicity compared to anything else. So that would be what I would recommend, sir, for that particular purpose. Did that answer your question okay? Okay, very good. Anybody else? Over here? Okay, looks like that's it, Alan.
Thank you very much.
Oh, my pleasure. Thanks, everybody, for coming out. By the way, don't miss the Buffalo Taste of the Entourage Effect if you hadn't used CBD or CBG.